When a woman reaches her late 40s or early 50s, the body undergoes a biological transition. This is a shift into a new metabolic baseline, one that requires a completely updated operating strategy. The catalyst for this shift is estrogen. As levels of this primary reproductive hormone fluctuate and decline, it triggers a chain reaction across the body's systems. With less estrogen circulating, the baseline metabolic rate slows down. At the same time, the cells alter how they handle insulin, making the body less efficient at processing carbohydrates. These internal metabolic shifts lead to an increase in systemic inflammation. That low-grade inflammatory response is a primary driver behind the deep fatigue and persistent brain fog so many women experience. Hot flashes, night sweats, and brain fog are the body's logical reaction to navigating a new environment. By changing what goes on the plate, we can align with this shift rather than fighting it. This visualization shows the results of the 2023 WAVS randomized controlled trial, tracking standard menopause symptom progression against a specific dietary intervention. The intervention was straightforward. Participants ate a low-fat, plant-based diet that included exactly half a cup of soybeans every day. No medication, just food. Within 12 weeks, moderate to severe hot flashes in that group dropped by 88%. Proactive nourishment yields clinical-level results. It is a highly effective way for a woman to take immediate control of her daily symptoms. To understand how half a cup of beans can stop a hot flash, we have to look away from the plate and scale down into the digestive tract. The gut plays a central role in how the body processes and clears hormones. Inside the microbiome is a specialized collection of bacteria called the estrobolome. Its job is to metabolize and recycle estrogen throughout the body, but those bacteria require specific fuel to function. They thrive on dietary fiber and fermented foods like kefir, yogurt, and kimchi. If the gut is deprived of fiber, the estrobolome starves. When that happens, the body loses the ability to convert plant compounds into the active molecules needed to fight symptoms. Without a diverse, well-fed microbiome to process these inputs, even a healthy diet cannot effectively balance fluctuating hormones. When the gut is healthy, we can introduce phytoestrogens. These are plant-based compounds found in whole soy and flaxseed, and they act as the first line of defense against hot flashes. Because they share a similar molecular structure, phytoestrogens work by docking into the body's estrogen receptors, creating a mild estrogenic effect when natural levels are low. This exact mechanism is the biological driver that reduces both the frequency and severity of vasomotor symptoms. Next are omega-3 fatty acids. A systematic review of postmenopausal health published in PubMed tracked their impact across multiple trials. The EPA and DHA compounds found in fatty fish actively suppress inflammatory signaling. That suppression leads to reduced joint pain, improved sleep quality, and lower rates of depression. Meanwhile, minerals like magnesium and calcium intercept the accelerated bone density loss and muscle tension that occur when estrogen drops. These foods are highly specific biological equalizers that target and soothe menopausal symptom pathways. Adding specific nutrients is half the equation. The other half is recognizing which inputs actively destabilize a fragile biological baseline. Alcohol causes peripheral blood vessels to dilate, raising core body temperature, while simultaneously fragmenting the restorative REM stages of state. Refined sugars create rapid spikes in blood glucose and insulin. Those spikes drive up systemic inflammation, which amplifies the intensity of hot flashes. Removing these triggers is a deliberate choice to take unnecessary stress off an adapting biological system. We can translate this microscopic science into a practical weekly framework built entirely around addition. The primary rule is to fill half the plate with colorful vegetables at every meal. This guarantees the fiber necessary to keep the estrobolome active. Next, pair all carbohydrates with a protein or a healthy fat. This simple pairing stabilizes blood glucose, preventing the sudden physiological spikes that trigger hot flash episodes in the middle of the day. For weekly targets, aim for a phytoestrogen source 3 to 4 times a week and fatty fish or omega-3 seeds twice a week. Consistently hitting these targets transforms eating from a source of anxiety into a predictable way to manage how your body feels during this transition. Whole foods provide the foundation. But the complexities of estrogen fluctuation and cortisol dysregulation sometimes require targeted support to bridge the gap. Vodavive is formulated specifically for this transition. combining the exact botanicals, B vitamins, and probiotics needed to cover the nutrient gaps of perimenopause and menopause. Menopause is a unique metabolic phase. You now have the nutritional framework to support your body's changing needs. Nourish your next chapter and support your changing body naturally.